Let's listen to an expert doctor, Dr. Nishad Chitnis, cardiologist, Heart Care Clinic, Kolhapur, for hypertension in young population along with the coronary artery disease and higher heart rate. Can be sure of happy heart?
Hello everyone, I am Dr. Nishad Chitnis, a consultant interventional cardiologist working at the Heart Care Clinic, Kolhapur. And today we are going to talk a little bit about heart failure.
Doctor, can high blood pressure be completely cured?
High blood pressure cannot be completely cured. म्हणजे आपण ते पूर्णपणे ते थांबवू शकत नाही. It has to be controlled. We give drugs and these drugs will control the blood pressure, but the drugs have to be continued indefinitely. The doses may have to be increased or decreased depending on how the blood pressure is. पण असं कधीच होणार नाही की सगळ्या गोळ्या बंद करता येतात. आयुष्यभर चालू ठेवायला लागणार असेल. So it can be controlled, but it cannot be cured totally.
Doctor, what is the relevance of heart rate in hypertension?
Heart rate is an important point in hypertension. Patients who have a high heart rate, they actually do worse if they are hypertensive than patients who have a normal heart rate. Because a high heart rate means that there is a double load placed on the heart. एक तर pressure जास्त आहे, so the heart is pumping harder, आणि rate जास्त आहे. So your heart is pumping harder and more frequently. So that is a more load on the heart and that is a greater strain on the heart. So consequently, things that harm the heart tends to suffer more and we get the long-term problems of hypertension earlier. तर त्यामुळे हार्ट रेट आणि बीपी दोन्हीही कंट्रोल करायला लागतात. You cannot just control one, you have to control both.
Doctor, what precautions should a patient take along with medications?
Along with medications, there are several lifestyle changes which should be done. First and most important is reduction in the salt intake. Too much salt is going to increase the blood pressure across the board, and keeping salt intake limited within this global recommendations will help in control of the blood pressure. Secondly, exercise. Exercising does over a long term help in control of blood pressure, even reduce the blood pressure. Third is weight control. The more your weight, the more likely you are to have high blood pressure and the tougher it is to control. You reduce your weight and the blood pressure is much easier to control. And finally, stress relief. Stress increases BP. So if you take steps to relieve stress like meditation, yoga, or even taking regular vacations or keeping our weekends away from office work, it does help a lot in controlling the blood pressure.
Public awareness initiative by Glenmark Pharmaceuticals.